Alright, I'm here to explain Chapter 19, Quality Improvement in Resource Poor Countries. This chapter explains about the systems that are implemented to improve these poorer areas and how much they are suffering. Um, as you can see here right away, the life expectancy from low to high income is a difference of 25 years, and the low income countries account for a large amount of the world's infectious diseases. For example, sub-Saharan Africa makes up about 12% of the world's population, and it has 70% of HIV cases, 37% of tuberculosis cases, and has 80 to 90% of all the malaria deaths in the world. And high income countries have more of the non-communicable diseases, which is like cancer and whatnot. And here you can see the life expectancy versus income chart, and it does show pretty significant, other than Brazil, which has probably other things going on, like a pretty decent healthcare system, which doesn't necessarily relate to this as much. But places like India and Africa are definitely suffering from the low income. Okay, here I want to talk about the launch of a program made by MDG, the Millennium Development Goals. Um, Basically, world leaders came together to reduce extreme poverty and gender inequality, mitigate the effects of climate change, and most of all here, improve healthcare outcomes by establishing a series of time-bound targets. And these three targets that they had here were tackling the maternal deaths and improving reproductive health, reducing the child mortality rate by 2/3, and halting the HIV and malaria and tuberculosis epidemics. Much of it is focused on improving health outcomes with assistance from the government and partner organizations. And they get a lot of help from a number of bilateral organizations as well. All right, so what they were able to achieve was having better access to vaccines, which averted over 4 million deaths in the past 10 years. They coordinated campaigns to give better access to antivirals for AIDS and made some reasonable progress on eradicating malaria. Um, if everyone had strong evidence-based knowledge on the implementing through effective programs, it would most likely they would be able to reach their goal. All right, principles and models of quality improvement. The principles of the quality improvement, a series of events based on systemic review. All processes have a customer for their outputs. The goal of the process is to add value to that customer. The core of quality improvement PDSA cycle, the Plan, Do, Study, Act. I'll be showing a chart here in just a moment to further explain that. Lean thinking is based on the belief of reducing waste in the system, and waste is defined as all activities that don't add value. And the 7 things that identify waste are the overproduction, unnecessary transport, unnecessary motion, inventory inefficiency, errors, overprocessing, and excessive waiting. And Six Sigma is based on eliminating defects and reducing variability. A defect is defined as an outcome that doesn't meet the requirements of the customer. Six Sigma and lean thinking are becoming very popular in healthcare quality improvement strategies in higher economic countries. Six Sigma is harder to implement in poor countries due to the difficulty of training the employees, the mathematical skills needed, and the broader staff to actually run the program. And the PDSA cycle and model for improvement here. Probably best you pause this and kind of jot down what's on here. I think it's a good figure that, it kind of self explains the whole cycle. The 6 factors for successful implementation of quality improvement initiatives. Creating clear improvement aims focused in both process and outcomes, encouraging and ensuring active participation of all stakeholders, defining measures that are relevant to the aims of improvement activity, engaging participants in data collection, generating change ideas collaboratively, and creating a learning network for change acceleration and sustainability. And here, describe the 5 characteristics of change that make it more likely to spread rapidly. Relative advantage. How well does innovation appear to address the needs of the larger community that is adopting this change? Compatibility. How closely do the change ideas align with the existing culture and environment? The simplicity. I mean, how easy is understandable are these changes? The trialability. Can the changes be adapted and tested in new environments in which they're being spread? Observability. How transparent are the innovation and its results to the viewpoint of the potential adopter? And here I have a couple examples of quality improvement in the poor countries. Um, in India, they use the Six Sigma method to reduce the number of catheter related bloodstream infections by 66%. And in a tertiary hospital in Blantyre, Malawi, they redesigned the physical layout and improving the flow of patients by adding an emergency department and an outpatient clinic for children younger than 5. This reduced the inpatient mortality rate from 10 8 to 18% to 6 to 8%.